Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for vaginismus. What is vaginismus? Vaginismus is defined as persistent involuntary spasm of the outer third of the muscles of the vagina interfering with coition, causing distress and interpersonal troubles. This state is somewhat comorbid with dyspareunia or vaginal atrophy. Dyspareunia, vaginal atrophy, these are somatic disease, physical diseases. Dyspareunia means painful coition. Vaginal atrophy is the vaginal mucous membrane is completely degenerated. These two diseases actually can also give rise to vaginismus. Actual cause of vaginismus is partly somatic and partly psychological. It is neither fully physical disease nor fully psychological, rather partly physical and partly psychological. What are the factors of vaginismus? Fear of sex due to trauma, past abuse, rape, childbirth injury, prior surgery, anxiety disorders, lack of interest in sex, history of urinary tract infection, poor health, member of a family having similar problem, endometriosis. Endometriosis is a complete disease. This is a complete disease. The disease is image here. We know that in the uterus, every month the endometrial tissues develops, and at the end, towards the end of the cycle, it sheds. This is called blood menstrual discharge. Though this endometrial layer is within this uterus, sometimes that endometrial tissue come outside. This is black. These black portions are all endometrial tissue. Somehow come outside and they remain on the over the various sites of the uterus or other parts, the vaginal, maybe fallopian tube or ovary. Now what happens actually when this endometrial tissue sheds, they also sheds. When they bleeds, they also bleed. When they develop gradually from minimum to maximum swells up, these tissues also do the same. That is, in every cycle, what happens within the uterus, the same thing happens in the outer tissue also. This is a peculiar disease and is painful disease too. This disease is called endometriosis. It is one of the causes of vaginismus. One of the causes. Psychological and emotional distress, unresolved psychosexual conflict in early childhood or women fixated at the pre-Oedipal or Oedipal stage. This is complete psychological thing. Just listen. Freud, Sigmund Freud is very much famous person for his concept of personality development. He believed that sexuality began in infancy and that the appropriate resolution of each stage had serious implications for later personality development. From birth to 18 months, infants derive its pleasure from mouth in the form of suckling, biting, chewing. This is known as oral stage. From 18 months to 3 years, pleasure comes from bowel and bladder evacuation or constraints of toilet training. This is called anal phase. From 3 years to 6 years, pleasure comes from genitals, and conflict is within sexual desire for opposite sex parent. This is called actually phallic stage or genital stage. Now each stage must be completely resolved in order to go to the next stage. If in some stage is disturbed, then the personality will be fixated at that stage. Now here it is pre-Oedipal. Oedipal means the stage of phallic, last step. In that stage it is not properly resolved, so the lady with vaginismus are probably fixated in the pre-Oedipal or Oedipal stage. Now this picture, this is normal vaginal opening. This note the opening. Here, note the opening. The opening is completely closed. Almost the space is narrowed down because of this spasm of outer third of muscles of the vagina. What are sign symptoms of vaginismus? Feeling discomfort, pain during sex, inability to place a tampon. Inability to place a tampon. This is tampon. It is sometimes requires to be planted. Tampon within vaginal canal. Inability to allow doctors to examine private parts. Feeling overwhelmed, highly tensed with thinking of sexual act. How common is vaginismus? Very difficult to say. A lot of cases are not reported at all for so-called taboo. That is, for social taboo, these cases are not reported. As such, there is no distinct statistic as to how common this disease is. Is vaginismus life-threatening? Not at all. However, the affected one needs care and support. It seldom goes away spontaneously. It is amenable to management. Approach is generally multifaceted. That is, the approach is not in a singular way. That is, you give medicine and it will be cured, or you give other type of treatment, some psychological treatment, it will be cured. Not that. The combination of treatment is required here. There is a multifaceted treatment. How a case of vaginismus is managed. The sole aim of management is to make the sexual act easy and enjoyable, as it should be. Generally, more than one or all of the following procedures are employed to manage depending on the situation. First one, topical therapy. Various types of creams are used locally to lubricate and make the passage, that is vaginal passage, less obstructive and less sensitive. Xylocaine 2% jelly is used extensively. This is most commonly used because it has the property of partial anesthetization of the particular place, as well as it lubricates. Application of remedies. There are remedies means actually our remedy, homeopathic remedies. There are as many as 42 different remedies in homeopathy. You can consult any of them from the classical book of Homeopathic Therapeutic written by Dr. Samuel Lilienthal. Available for free download from net, free of cost. Herein I just mention only 10 remedies of my choice. Cognitive behavioral therapy. It helps the sufferer to understand how their own thinking, emotion, behavior help maintain the problem. That is their own attitude as maintaining their problem. That is the perception of that thing is given to the sufferer so that they can mentally also be prepared. This psychological therapy attempts to dilute the same through proper advices and suggestions. Vaginal dilator therapy. Following applications of topical cream, these are used to stretch vaginal space slowly and mechanically. These are dilators. These dilators are used from lesser diameter to gradually higher diameter use so that the space within the vaginal passage is enlarged. Lastly, sex therapy. Help of sex therapist is required in some of the problematic cases. Generally, it is not required, but sometimes the help of sex therapist is required. Generally, they work in conjunction with sufferers and their sex partners. That is, the lady who is suffering from vaginismus and her sex partner. With the help of both of them, the sex therapist perform their technique of easing the problem. Now we are coming to remedies. Silesia for vaginismus. Pressing down, feeling in vagina. Parts tender to touch, itching of genitalia. Give Thalassia 30 4 hourly. Sepia for vaginismus. Painful coition. Jerking pain in vagina from below upwards in the morning on waking. Continuous stitching pain in vagina with bearing down sensation. Sensation of a ball in vagina. Patients highly indifferent to loved ones. Sepia 30 4 hourly. Platina for vaginismus, spasms and constriction of vagina, anxiety, depression of spirit, palpitation of heart. Patient suffers from superiority complex, think all others worthless and hate them. This is a peculiar mental attitude of platina patient. Give 34 hourly. Tarantula hispanica for vaginismus, burning as if hot coal were in vagina, preventing sleep and causing her to walk on the floor. Throws thing away. Patients laugh, mock, run, dance, sing, cry, gesticulate till get exhausted. Gives tarantula 30, 3 hourly. Netra mure for vaginismus. Vagina dry, extremely. Involuntary urination when walking, coughing, laughing. Hair fall out when touched. Give netra mure 30, 3 hourly. Alumina for vaginismus. Stitches in left side of vulva extending to chest. Vagina dry. Patients crave indigestible things like chalk, charcoal, coffee ground, etc. They think that time passes too slowly. It is their personal feeling. Give alumina 34 hourly. Bromium for vaginismus. Escape of loud flutters from vagina. Sore pain in vagina. They look constantly at one direction without saying anything. Vacant look. They do not feel normal but do not know why. Bromium 6 too early. Causticum for vaginismus. Complete aversion to question. After urinating, smarting in pudenda. Pudenda means vagina. As from salt. As if salt is there. They are very much sympathetic to other sufferings. This basic causticum most important mental general symptom. Give 34 hourly. Coffea for vaginismus. Vagina oversensitive, aversion to intercourse due to pain. Patients cannot go to sleep. Ecstatic, full of ideas, cannot tolerate sympathy. This coffea patient, if you go to sympathize him, he will go furious. Coffea 6, too early. Arsenic for vaginismus. Lancinating pain from abdomen to vagina. Burning as if hot coal in vagina. Preventing sleep. Worse in midday and midnight. That is arsenic patient. All his complaint or her complaint rather. All her complaint most get worse around 12 noon and 12 night. Patient extremely restless, anxious, suffer from fear of death. Give arsenic 34 hourly. With this the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I would certainly respond. Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents.